Hey everyone, welcome back to the Top MD channel. I'm Dr. Simpson, Pulmonary and Critical Care Fellow and CEO of Top MD LLC. At Top MD, we help you master the boards and match with confidence. Today, we're breaking down a USMLE favorite, DKA versus HHS. Let's make this easy. Pathophysiology, DKA. Think type 1, DM. No insulin, lipolysis, ketones plus metabolic acidosis. Buzzwords, ketones, acidotic, co-small breathing, HHS. Think type 2, DM. Enough insulin to prevent ketosis, but not enough to prevent hyperglycemia. Buzzwords. Very high glucose. No acidosis. Confusion. Dehydration. Lab differences. First up, glucose levels. In DKA, blood glucose is elevated, typically over 250 mg/dL, but not always sky high. In HHS, it's through the roof, over 600 mg/dL. So think, mild to moderate hyperglycemia in DKA, extreme hyperglycemia in HHS. Now, let's move to arterial pH. DKA is an acidotic state. You'll see a pH less than 7.3. Meanwhile, in HHS, the pH is normal, or usually above 7.3, because there's no significant ketoacidosis. What about bicarbonate? In DKA, bicarb levels drop, less than 18 μQL, sometimes much lower, because your body is using it up trying to buffer all that acid. In HHS, it's usually greater than 20, again because there's no acidosis. Let's not forget the ketones. In DKA, ketones are positive in the urine and blood due to unchecked lipolysis. In HHS, ketones are absent or minimal. That's a key difference. Now here's a buzzword gem, anion gap. DKA gives you a high anion gap metabolic acidosis, over 12. HHS might have a mild gap from dehydration, but it's not a primary acidotic process. Clinical features, DKA, rapid onset, fruity breath, abdominal pain, nausea, deep co-small breathing, HHS, gradual onset, severe dehydration, mental status changes, no GI symptoms, treatment, same general strategy, but pace matters. Fluids first. Insulin, but go slower in HHS to avoid cerebral edema electrolytes, especially watch potassium. Treat underlying cause, infection, MI, etc. Complications. DKA, cerebral edema, hypokalemia, HHS, seizures, thromboembolism, very high mortality. Now for a quick recap, DKA, ketones, plus acidotic, plus fast onset, HHS, hyperglycemia, plus neuroscience, plus no acidosis. Know your buzzwords, manage the fluids, and give that insulin. Thanks for tuning in. If you found this helpful, like, share, and subscribe to the Top MD channel so you don't miss future updates. Stay focused, stay confident. We'll see you next time.